This is my ATTR 756 reflection of goal setting and action plan for the next semester. Really what I had was 3 to 4 clinical practice goals and 3 to 4 educational goals, some of which I believe I met and some of which I failed to meet, and sort of need to reorganize my approach and my goals for the next semester. The first clinical practice goal I had was to schedule and attend a seminar in the main athletic training room for Dr. Chu to sort of come in and talk to the athletic trainers about recognizing red flags, signs and symptoms of mental health issues, and sort of bridge the gap between departments. So Dr. Chu in the summer had sort of expressed that the relationship between ISU AT services and the counseling department had kind of gone away. In the last semester, there was not really much communication going on, which I thought was a problem and I think could be detrimental to the patient care. So I kind of wanted to do something that would bridge the gap. So I believe I was successful in this goal and that we actually did have the seminar, and we're in communication with Dr. Chu to actually have another seminar. So I think just by communication alone, I've met that goal. However, I don't think my peers and my colleagues got enough out of it simply because not a lot of people came to the seminar. I hope to have a better turnout, but I think I'll continue to improve the relationship between departments by contacting Dr. Chu more often and asking for another seminar, maybe during DAT weekend or at a better time that would be better for the schedules of all the other athletic trainers, both on and off campus. My second clinical practice goal was to incorporate the passive physiological intervertebral motion testing. I did have 2 symptomatic patients that I applied this technique with, and I did have positive global rating of change scores, so in that way I think I met the goal, but I really want to stay confident in this area and keep up to date on the current evidence. So where I want to go with this goal from here, I really want to be able to teach someone else, one of my peers or colleagues, this particular technique, just so I can stay confident, and since I won't be applying this technique likely until the fall with my symptomatic volleyball athletes, perhaps I will have a basketball player that I can use it with, but I think if I can teach somebody else the technique, it'll kind of keep me current in the area. Really, where else I want to go with this goal is to, and just manual therapy in general, is to kind of let go of the past frustrations that I had with the class and approach the next class with sort of an open mind, kind of a clean slate, because I really want to take full advantage of the new content and try to incorporate it into my clinical practice as much as possible. And sort of if I'm dwelling on the past and how I didn't get as much out of the last class as I wanted to, that'll hinder my ability to kind of have an open mind moving forward. My third clinical practice goal was to administer 3 new patient outcome measures on 5 patients by the end of the spring semester. Looking back on my sportswear data, I used the IHOT-12 on the hip, the FAM, and then I didn't use a patient-rated outcome measure as the third one, but I did use a functional test, the single-leg hop for distance. I think I had multiple follow-ups in a systematic manner, looking back into sportswear, to really know if patient perceptions are becoming more positive. But going forward, I do have a habit of sometimes I have patient-rated outcome measures in a systematic manner in sportswear with certain patients, but then other patients I just use PROMs really randomly, and it doesn't give me a good timeline or progression of their pathology. So going forward, I think I can look back into their progress notes and see the last time I took down the PROM information and the data that the patient gives me, and then implement them systematically or kind of on a schedule so I can really track progress in a systematic way. In terms of my educational goals, I did attend the seminar that I was looking for at GLADA. It was Engagement Drills, Preceptor Preparedness 101. And I really wanted to accomplish this goal because I knew that I was going to have 2 new students coming in with me in the fall. And now that I know who these students are, I know that they're highly motivated. I've heard really great things about these students, and I want to take full advantage of my role as a preceptor. I think that my role as a preceptor has changed a lot over the last semester because I had a particularly difficult student that wasn't necessarily interested in learning and was not motivated to learn, and used me as a resource to get better and improve his clinical practice. So I'm really excited to get new students and take things that I've learned in this session. We talked about new technology, new approaches to learning in this session at GLADA, and I think I can really use 3 to 4 things in the fall with my new students to help them grow as clinicians. My second educational goal was to engage in interprofessional practice and collaboration during my sports psych class. I really wanted to take full advantage of having a face-to-face course since this program is primarily online and I don't necessarily always get that. And I don't think this goal was as successful as I had hoped. I think my relationship between the volleyball strength coach, who's also in the class, and myself has improved, but I'm not sure that that was because of the class and taking the class together. I think that was just primarily because we worked together closely, and our relationship improved during practice when I would go down and speak with him about injuries. And I didn't really have any other interactions with any other professionals this semester, other than the physicians we work with on campus and the nutritionist who I really already had interactions with in the past. So I don't think my IPP or IPE goal really was met. I obviously enhanced my relationship with the psychology department, which I think was important, but I didn't get that enhanced relationship from my actual applied sports psychology class. Most of the students in the class were either strength and conditioning or coaches, so I didn't really improve my relationship. So I would like to, in the next semester, improve my IPE. I just have to reflect back and think about who I can work with at ISU that I haven't already to kind of branch out my collaborations. My last educational goal was to develop an awareness and action plan for colleagues, peers, students, and patients on LGBT workplace discrimination. I think the stakeholder project changed this goal a little bit because of accessibility and feasibility. I wanted to sort of implement this large-scale kind of awareness plan, but I didn't feel like the head athletic trainer was very accessible and willing to have kind of this open conversation about the issue. And with the new athletic director, it was kind of hard to navigate because I didn't know for a while who was the new AD when my timeline with my lesson plans, I wanted to stick to the timeline, but the week that I was trying to set up these meetings, I didn't even really know who the new AD was, or if he would be willing to meet with me. But now that I've met with Dr. Irvin, I think that throughout the summer, when they do the ally training, I plan to attend the ally training, and Dr. Irving was very open to having other athletic trainers attend the ally training and making the athletic training room a safe zone. So I'm kind of going to alter my goal a little bit and taking it forward in the summer and then in the fall. And then further on that goal, I'd like to continue to try to incorporate the new athletic director in spreading awareness, and that hopefully will be accomplished by an upcoming meeting with Dr. Irving and I. In terms of my scholarship goals, I think that my thesis, comparison of whole body cooling techniques, my goal was to get that submitted by March 1st. Obviously that didn't happen, and I would say that was a failure on my part. I guess I underestimated the time that it would take to do my manuscript and submit and then kind of have a turnaround. And since we kind of got rejected from Journal of Athletic Training, or they weren't interested, we have to go to a different outlet. And I think that's on me to explore different military journals and hopefully get a submission and down the road a publication from my thesis. For my workplace discrimination in athletics and healthcare, I did meet that goal. It was submitted by March 1st. However, I have not heard back from the journal. It was submission via email, so I'm not even sure that they received my submission. So I really think I need to follow up with them soon, or simply try a different outlet or a different journal. My last scholarship goal was really to discover a new research interest, and I think I did that with LGBT workplace discrimination, and I really do think I have a passion for mental health issues in athletics within patients, students, and really just athletic trainers. So I think I developed 2 new research interests, which I think will help me progress both in the summer and in the fall in terms of research projects. That was kind of my reflection on where I have been, and now I kind of want to just talk about where I want to go. My action plan really encompasses 3 main goals. The first, I want to do more with the patient-rated outcome measured data that I have. I think I'm doing a good job of actually using PROMs and implementing them in my clinical practice, but I want to do a better job of taking the data and the information and adjusting the treatment, evaluation approach, and I want to review the answers more thoroughly before moving on. So while I do ask probing questions if the patient on the quick dash says, I can't wash my hair, I do ask them more about that, but I need to take it a step further and alter their actual treatment or my evaluation to reflect their scores on the PROM rather than just taking down the data and moving on. So how I think I can do this is with my new students in the fall, I can do weekly meetings before treatments with students to discuss PROM data and alterations of treatment. So if I can have my students hold me accountable to actually taking the PROM data and vice versa, me holding them accountable, I think I will do more with PROMs. My second goal has to do with my scholarship. I plan to discuss with Dr. Games alternative military journals and submit my thesis. I really want to do this by June 1st, and obviously the measurement would be a successful submission and hopefully publication. But I just need to be a little bit more proactive in finding what journal I really want to submit to. And lastly, the main goal for me is just to continue to advocate for LGBT student athletes by involving the new athletic director and continuing to build that relationship with the Diversity Center. I think this is ongoing, and I talked a little bit about the ally training and follow-up meetings with a new AD, and I really think that I can measure this by a successful meeting, and then my next goal would be implementation.